Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk about my views on therapy today. So I love the entire alphabet soup of therapy. A lot of people will ask me whether or not I feel like therapy works well with ketamine or stellate ganglions or nitrous oxide or TMS. And I think therapy is just one more tool in our tool belt to help us integrate the changes from these interventional treatments and really have a better system going forward. Just like I wouldn't want to have a beautiful, wonderful meal in front of me without a knife and a fork and a spoon. I think therapy is sort of integral as well to helping us understand our motivations, our thought processes, the relationships in our lives, and how to set goals and respond and really focus on what's next and moving forward. I do think that talk therapy can be a really beautiful thing for investigating our past and our histories and seeing how that influences our current day and our future as well. I love almost all kinds of therapy. Talk therapy is wonderful. Really having another person, particularly in person. I love in-person therapy. It allows us to see the whole body of a person. Are you mentioning something? Are they tensing up their feet? Are they tensing their jaw? Are they looking away? How are they responding to the things you're bringing up? And I think that having that person in place really is very powerful. So I would recommend to any of my patients doing in-person therapy over Zoom therapy. And I know that a lot of patients these days are doing AI-based or computer-based therapies, sometimes even telephone therapy. And I just don't think that's quite as good. If that's what fits your budget and that's all you're able to do, I think that's better than nothing. For sure, I think that's better than nothing. But I do strongly believe that if it's possible, if it's in your budget and your schedule, nothing beats in-person therapy. I love long-standing relationships with therapists. I really think that they get to know you, they get to know your problems, they can help sort of catch you in, a lot of us can do things to protect our egos that maybe aren't the best for us, and a long-term relationship can really kind of catch us in those things and call us out on them. I'm also a huge fan of short-term, problem-focused, solutions-based therapy, where you get to know a person, you work on one problem, and then you have kind of a timeline or a deadline for your therapy, and you move on from there. So I definitely like both. I strongly believe, like I said, in the alphabet soup of therapy. So if you've done acceptance and commitment therapy and you're just not getting the results that you want, try cognitive behavioral therapy. If you've done CBT, try IFS. If you've done IFS, try Jungian. So there's so many different kinds of therapy, and a little bit of each of them will kind of stick to you. Maybe you don't kind of mesh with all of the tenets of cognitive behavioral therapy. It doesn't speak to you. You're not comfortable with it. Great. You've tried it. You learn something through working through all the different processes in the different kinds of therapy. So, highly recommend just trying out some of the different alphabet soups of therapy. One of the things that I really recommend to my patients is, even if you're in a great therapeutic relationship, but especially if you're not, there are amazing podcasts, books on tape, YouTube therapy videos. There's so many ways to access this information. And even if you're in therapy once a week, I highly recommend accessing this information a little bit every day. And the reason for that is it's so easy to compartmentalize your therapy to Wednesdays from 3 to 4 o'clock in the afternoon, and not bring home the idea of, I'm going to be implementing the things that I'm learning in therapy all throughout my daily life. So I'm going to be implementing this in this situation. I'm going to bring my therapy into this relationship. And so really having the homework or the reminder every day of just a little bit of therapy, a little bit of learning about your mental health, a little bit of learning a different way of thinking about mental health, a little bit of something every day to remind you, one, it's a priority, two, that it is accessible, that it's available to you to curate and to think about every day. Because I think life gets so busy that it's very, very easy to say, well, I just don't have time for this today. I'm so busy. I'm traveling. I'm working. I've got a family. I'm so busy. I don't have time for this. And then put it on the back burner and not spend time working on it every day. And I think if you do that for your physical health, you'll see yourself get weaker. You'll see your weight go up. You'll see your chronic medical problems get worse over time. So it really is about focusing on our health, mental health and physical health, just a little bit every day to remind you that it's important. So I think it's really important to incorporate just a little bit of mental health into our everyday. Just like we wouldn't expect to exercise once and be fit, and just like we wouldn't expect to weed the garden once and have a beautiful garden, we need to take a little bit of care of our mental health every day, and trying various forms of therapy, picking up little bits that we can learn from each of the different kinds of therapy. Whatever particularly works for you and your situation out of each of those kinds of therapy, I think is really helpful. And I think it's a really great way to keep things fresh and interesting, and to keep our mental health as fit as our body.